Come on in. How are you today?
I'm alright.
My name is Brandy. I'm a student nurse with Vernon College. What's your name?
Walter.
Hi, Walter. All right. Today, what we're going to be doing is I'm going to be asking you a bunch of questions. And when I'm done asking you these questions, we'll go over to the examination table and I'll examine all your body from head to toe. Make sure everything checks out okay there. All right? Are you okay with that?
Yeah.
If there are any questions that are too uncomfortable for you, just let me know. We can revisit them later.
Okay.
How old are you?
29.
Are you male or female?
Male.
Okay, and why are you here today?
My family sent me in because I haven't been feeling well mentally and I've been hearing voices telling me to hurt myself and other people.
So the voices are telling you to hurt yourself?
Yeah.
What do you mean by hurt yourself? What do they mean?
Kill myself.
To kill yourself?
Yeah.
So are you suicidal?
Yeah.
Do you have a plan of how you would kill yourself?
Yes.
Okay. Can you tell me about your plan?
They tell me to kill myself with a gun, but I don't have a gun.
You don't have a gun?
No.
Do you have a way to get a gun?
No.
Okay. Are you on any medications?
I take Abilify, 15 milligrams
And how often do you take that?
daily.
Okay. Do you have any allergies?
No.
And when's the last time you've been to a doctor and got checked out from head to toe? Every part of your body to make sure everything's okay?
I'm not sure.
You don't know. Okay. Are your shots up to date?
Yes.
Okay. So in the past, have you had any illnesses or trauma?
I have schizophrenia
When were you diagnosed with that?
in 2013.
Okay. How about hospitalizations or surgeries?
I've had 3 hospitalizations.
Where? Oh, I'm sorry. Go ahead.
2 for hallucinations, telling me to hurt other people, and alcohol detoxification, and 1 was I had a psychotic break in the Army.
Okay. So you were in the Army?
Yes.
How long were you in the Army?
About 6 months.
Okay. And that's when you had your break, I'm assuming. Did you get discharged?
Yes.
Okay. Okay, so you said that you were in for alcohol detoxification also?
Yes.
Do you still use alcohol?
Yes.
Okay. How long have you used alcohol?
Since I was 13.
Okay, and how much do you drink a day, a week?
10 or 12 beers a day.
10 to 12 a day? All right. And then you said you had schizophrenia diagnosed in 2013. Are you sexually active
Yes.
with males or females or both?
Female.
Okay. So in general, how do you feel?
Sad and tired.
Okay. Do you have any issues with your skin, your hair, your nails?
No.
Okay. What about with your eyes? Do you wear glasses or contacts?
No.
Your nose?
No.
Your ears, do you wear hearing aids?
No.
And do you have any kind of a sore throat or any throat swelling, any problems with your throat?
No.
Okay. And your respiratory, which is your lungs, do you have any issues with that? Have you been diagnosed with anything?
No.
And breathe okay?
Yes.
Okay. What about any kind of heart disease or heart issues, any palpitations or anything like that?
No.
Any blood clots?
No.
Okay. And this is stuff that a doctor's told you had, or even if you feel palpitations, okay? When was your last bowel movement?
Today.
And do you have any other kind of stomach issues?
No.
Okay. And how often do you think you urinate?
10 to 12 times a day.
Any burning,
No.
pain when urinating? Okay. Any joint, bone, or muscle problems?
No.
All right. Yeah, any brain injury or seizures or nerve problems?
No.
Okay, how about any blood disorders? Any diabetes?
No.
Any issues with your lymph nodes?
No.
Any kind of cancer?
No.
Okay. Okay, Walter. Now what we're going to do is called, because you told me that you were suicidal, you told me that you had a plan. We're going to do a bunch of these questions. I just need you right now to answer them, and this is within the past week, okay? Have you actually attempted suicide?
No.
Have you had an interrupted attempt, an aborted attempt, which means that you did something and then stopped?
No.
Okay. Any other acts to kill yourself in the past week?
No.
And have you had any kind of self-injurious behavior, like cutting yourself without intent to commit suicide?
No.
And have you ever had any of that in your lifetime?
No.
Okay. So do you wish to be dead?
Yes.
And this is in the most severe in the past week. Do you have suicidal thoughts? You said you did. You said you had suicidal thoughts with a method, but without specific plan or intent to act. Now, do you have a plan? You told me earlier you had a plan, right?
Yes. Just to shoot myself.
Just to shoot yourself. Do you know how you're going to get a gun or anything like that?
No.
Okay. Let's see. Have you had a recent loss of a significant other, family member, job, home, or anything like that?
No.
Are you pending incarceration?
No.
Are you homeless?
No.
Okay. You said that you had previous psychiatric diagnosis of schizophrenia, right? And that you were treated at a couple of different hospitals, is that right?
Yes.
Were you hopeless or dissatisfied with the treatment?
Yes.
Were you compliant with their treatment? Did you follow the rules? Did you do what they asked of you? Okay. And are you currently receiving treatment?
Yes.
No.
No.
No?
No.
Okay. And then you said, did I ask about your family history? Did I ask about that? I can't remember.
Yes.
Do you have a family history? I did. Do you have a family history of any mental disorders?
Yes.
Okay. Who?
My uncle has schizophrenia.
Your uncle was diagnosed with schizophrenia?
Yes.
Okay. Okay. So recently, have you felt hopeless?
Yes.
Helpless?
Yes.
Do you feel trapped?
Yes.
Have you had a major depressive episode?
Yes.
What about a mixed affective episode? Where you kind of are depressed, but you feel kind of high at the same time? At the same time?
Yes.
Okay. And you said you had hallucinations telling you to hurt yourself, correct?
Yes.
Have you had any impulsive behavior?
No.
And you said that you drank daily, correct?
Yes.
Do you have agitation or severe anxiety?
No.
I'm sorry?
Yes.
Okay. Do you feel like you're a burden on your family or others?
Yes.
Are you in any kind of chronic physical pain, or is there another acute medical problem like HIV, COPD, cancer, anything like that? Okay. What about, are you homicidal? Do you want to hurt others?
Yes. Yes.
Okay. Are you aggressive towards others?
No.
And you said that you did not have a gun, correct?
Right.
Okay, we don't have a safety plan made up for you yet, but if we did make up a safety plan, could you agree to adhere to it?
Yes.
Okay. Have you ever been sexually abused?
No.
Do you have a family history of suicide?
No.
Okay. Can you give me a couple of reasons that you do want to live, that you don't want to commit suicide?
I don't want to disappoint my family.
Okay. So you feel a responsibility to your family or others? Are you living with your family?
Yes.
Okay. And do you have a supportive network or family? Are they supportive of you?
Yes.
Okay. Do you have a fear of death or dying due to pain and suffering?
No.
Huh?
No.
Okay. And do you believe that suicide is immoral due to spiritual beliefs?
Yes.
Okay. Are you working or going to school?
No.
And have you tried contacting the suicide crisis hotline and talked to a representative there?
No.
Okay. Are there any other factors as to why you don't want to die?
No.
Okay. Okay, so now I'm going to ask you a bunch more questions. And I'll ask you if you've ever felt this way in your lifetime or if you felt this way in the past month, okay? Have you wished that you were dead or wished you could go to sleep and not wake up in your lifetime?
Yes.
And have you felt that way in the past month?
Yes.
Okay, and can you describe that to me?
The voice is telling me to kill myself or hurt myself.
Okay. Have you actually had any thoughts of killing yourself? You just said yes, correct?
Yes.
And that's within the past month, correct?
Yes.
And is that the same thing where the voices?
Tell me to hurt myself, but I don't have a gun.
Okay. And in your lifetime, have you thought about how you would do this, how you would kill yourself?
Yes.
And you said you thought about it in the past month, and that's with a gun, right?
Yes.
Hello. I'll call you right back. Check if your voices.
Okay. And have you had these thoughts and had some intention of acting on them within your lifetime
Yes.
in the past month?
Yes.
Describe that to me.
They've been telling me to kill myself or hurt myself with a gun.
Okay. And have you started to work out or have worked out the details of how to kill yourself? You said you don't have a gun, right?
Right.
So have you worked out any details of that?
No.
Okay. Let's see. In your lifetime, how severe is this ideation? On a scale from 1 to 5, 1 being that, it's persistent, you're going to do it. 5, I mean that it's not hardly even there, and then 5, it's persistent, you're going to do that. You've got a plan
5.
in your lifetime.
5.
Okay. And you stated that you want to purchase a gun and shoot yourself. So that's also the most recent?
Yes.
Okay. You said that it was due to command hallucinations telling you to do it. Is there any other reason?
No.
Okay. And how many times have you had these thoughts in your lifetime? Less than a week, once a week, 2 to 5 times in a week, daily or almost daily, or many times each day?
2 to 5 times a week.
Over a lifetime?
Yes.
And what's the most severe it's been? Has it ever been up to daily or?
Yes.
That's the most severe it's been? Okay. Okay, so when you have these thoughts, how long do they last?
About an hour.
About an hour. That's the most recent within the past month. And when I say lifetime, you're talking about this incident also?
Yes.
Okay. And could or can you stop thinking about killing yourself or wanting to die if you want to? In your
No.
lifetime, could you?
No.
Do you even attempt to control the thoughts anymore?
No.
Okay. Are there things, anyone or anything like your family, religion, pain of death that have stopped you from wanting to die or acting on thoughts of committing suicide?
My family.
Your family in your
Yes.
lifetime?
Yes.
And they did stop you? Just thinking of them stopped you? Okay. Let's see. What sort of reasons did you have for thinking about wanting to die or killing yourself? Like, is it, and we'll talk about most recently, okay, first, within the past month. Was it to end the pain or stop the way you're feeling? Was it to get attention, revenge, or reaction, or something else
Stop the way I'm feeling.
to stop the way you're feeling?
Yes.
Okay. And you said you've never had any previous suicide attempts, right? So that probably doesn't apply to your lifetime. You said you've never made a suicide attempt, correct?
Right.
Okay. And have you ever engaged in non-suicidal self-injurious behavior? Do you know what that is?
Yes.
Okay, have you ever engaged in that?
No.
Not in your lifetime, correct? Not in the past 3 months, correct?
Right.
Okay. Have you ever had an interrupted suicide attempt, meaning that you were about to do it and somebody came in or something like that? Something interrupted it?
No.
Not in your lifetime and not in the past 3 months, correct?
Right.
And the same thing about, have you ever had an aborted or self-interrupted attempt? Meaning you were about to do it and you just decided not to.
No.
Not in your lifetime and not in the past 3 months, correct?
Right.
Okay, have you taken any steps towards making an attempt or preparing to kill yourself? Like, have you gone to a gun store and looked at the guns? Have you started saving money to buy a gun? Have you looked online at guns?
I've looked online at them.
You've looked online?
Yeah.
Okay, so like in the past 2 weeks, how often do you look online?
Daily.
Daily? Okay. Okay, so that is that part of it. Now we're going to go ahead and go over to the exam table and I'll check you out from head to toe, okay? Give me that bill. Okay. Let's see. I forgot how I did this last time. Oh no. Move that. Move that blue thing. Okay. Oh, I guess I should have covered one more with that. Okay. I'm gonna start out by taking your blood pressure. You just relax your arm. glove boat, but I don't have any gloves, so anyways. I'm just gonna feel around on your head, Walter, see if I feel any bumps or anything like that. I don't feel any lumps or bumps, I don't feel any kind of masses. Look up at me. His ears look level with his eyes, his face looks symmetrical. I don't have my numbers. I'm gonna look in your eyes, okay? His conjunctiva is pink and moist, his sclera is white. Pupils are equal, round, reactive to light. Over there at that door, Walter. And accommodation. Can you open your mouth? Say ah. Okay, uvula is midline, tongue protrudes midline. I don't see any evidence of dental caries or decay. Mucomucosa is pink and moist. I don't see any abnormal movements of the tongue, any worm-like movements. And his ears are clear to free of obstruction. Can you hear me okay, Walter?
Yes.
Okay. Okay. I'm gonna check my notes here. I don't feel any swelling anywhere. His carotid is a 2+ non-bounding. And I'm just gonna listen here. I don't hear any bruise. His carotid is good. I need you to clench your jaws. Good. Can you feel that? Feel that?
Yes.
Okay. So his cranial nerves, lift your eyebrows. Okay, squint your eyes. Squint them. Good. Okay. His cranial nerves are intact. I'm going to look up your nose now, okay? Okay, I don't see any obstructions in his nose. Breathe out through your nose. Good. Breathe out. Good. You able to do that with ease? All right, so the nares are patent. I want you to lift your shoulders. Good. Give me your hands. Push. Good. Pull. Good. Okay. Relax. Pulses are equal bilateral, 2+ non-bounding. The skin is cool, dry to the touch. I don't see any kind of anything. He's got a tattoo right here. No, I don't see any lesions. What happened up here, Walter?
I don't know.
You don't know? Okay. You got a big bruise and some kind of abrasion right there and a scar. What's your scar from, Walter?
A brand.
Huh?
A brand.
A brand. Okay, so some self-mutilation going on. Some more.
I didn't do it.
You didn't do it? Okay. Got a big scar right there. What's that scar from?
I got hurt when I was a kid.
Got hurt when you were a kid and another tattoo. Other than that, his skin looks good. It's cool, dry to the touch. Let me check out your back, Walter. Okay, just relax your arms. Sit up straight. Got another tattoo going down his back right here. Take a big breath. Okay. The expansion is equal and bilateral. I don't see any kind of lesions or I don't think any kind of masses. Good. Walter, I need you to say 99.
99. 99. 99. 99.
Okay, good. I'm going to listen to your heart. Heart, Walter, okay? Sit up straight. All right, here's always where I can hear the apical pulse, I'd actually just sit here and listen to it for a minute. And I listen to lung sound, I don't hear any extra heart sounds, I don't hear any murmurs. Breathe in. Good. Out. Every time I place my stethoscope, you breathe in and out. Good. Okay, good. And then I'm going to go around to the back and do the same thing on the back with his breath sounds. Listen for bronchovesicular sounds, which he does have normal bronchovesicular sounds up higher towards the middle. And then as I go lower, it'll just be vesicular sounds, which I don't hear any adventitious stuff going on. All right, Walter. So, let me feel your throat here. The trachea is midline. I want to look at your chest to make sure no lesions, nothing like that going on. 99?
99.
Good. Okay, so obviously this is not a real bed. You're just going to lay down and dangle your feet. Okay, Walter, I'm going to start down here. Push on my hands with your feet. Okay, pull back. Good. Check the pedal pulses. They're all equal bilateral 2+ non-bounding. His skin is warm and dry to the touch. I don't see any lesions or anything like that. Was there any pain while you were pushing on my hands?
No.
Okay. Okay, I'm going to go to your belly and listen to it. I'll listen to his bowel sounds. I'll do 5 seconds in each quadrant. Okay, normal active bowel sounds. His abdomen is flat. There, Walter. And I'm going to palpate for any masses. Any pain with that? No? Okay. So no masses palpated. I'll also, while I'm here, and no pulses, no visible pulses or anything like that. I'm palpating for any kind of thrills or anything around his heart, which I'm not feeling. All right, you can go ahead and sit up. Okay, Walter, can you stand up for me? I want you to just relax your arms by your side. So there's some mild tremors going on with his hands. I need you just to walk to the table and walk back. Okay, walk back. His gait's normal, there's no shuffling or anything like that. Okay, Walter, well, I appreciate you participating in this. Thank you.
Appreciate you too, Paul.
Uh-huh.